Welcome back, Cincinnati, and to another Facebook Live with us here at the Plastic Surgery Group. I'm Terry.
I'm Joyce.
And today we're being joined by Leslie, who, as you know, regular viewers of our Facebook Live, you would know her as our camera lady. She's the camera lady, but today she's going to be talking to you about Coolsculpting, because not only does she film our Facebook Lives, you're also one of our Coolsculpting experts here at the Red Bank
We do
office.
have to give a heads up for our new videographer.
Yes, Sarah.
Who's being another member of the marketing team. Yes. Yep. Who doesn't want to be showcased today. So
that's fine.
We'll have to get her in another one.
That's good.
We're super excited about this today. This is something we are so passionate about here at the Plastic Surgery Group. Every single one of us, which legit, if you could see Sarah, you'd be shocked. We've all had Coolsculpting done and absolutely love it. So passionate about procedures that work here. And this is one of those things that, you know, we've done it now since 2014, I believe, and seeing reoccurring patients come back, you know, for different areas of their body because of the success rate. And that success rate is what keeps us all going, and it's inspirational to people to be able to finally spot reduce, basically. So we're going to ask her, Leslie, a few questions and let her give an opportunity to tell you exactly what happens during a procedure. Because when we're out and about in different events, last night I was at an event, and the questions that predominantly of course, about different surgical procedures, but we're asked about Coolsculpting on a daily basis.
Yeah.
It's one of those procedures that non-invasive, come in, get it done, go back to work, whatever, doesn't crimp your style, doesn't lay you off work at all. It's just one of those things, come and go. So again, please, 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 if you have any questions about it, give us a call, come in for a consult. We do evaluations at all three offices. We have the
complimentary consults,
and we can evaluate you and let you know. And if it's not an option for you, and we can go into more detail about that, you know, some people have a BMI that's a little too high for Coolsculpting to really be effective. You know, rather than take your money, because we certainly could treat a lot of people that, you know, we just don't want to give you a false sense of where you can go with this. But we're going to have Leslie tell us a little bit more about what kind of expectations you should have about Coolsculpting. So Leslie, go ahead and share some of your wisdom.
Hi. So first of all, we do have 3 locations. So Red Bank, I do Red Bank. We also do it in Westchester. In Red Bank, it's Cassie and myself, Cassie Hiltz. There's a Westchester location, Tara and myself. I'm in Westchester. And then a Kentucky location, and that would be Frankie. So if you want to call and choose one of those locations. So Coolsculpting is basically the only FDA-approved elimination of fat besides liposuction. So it does work. They've done studies and research. It's very clinical, so we have a lot of detail that we have to put into it, steps I have to follow. So we all did training and intensive training. We actually did, initially we did a lot of reading, then we watched some videos on treatments, then we actually did treatments on staff, and someone watched us and kind of helped us along with that.
Prolonged experience too. No one comes in and just is turned loose for Coolsculpting until they've done a rigorous training, months of training on different patients and volunteers from the staff, which we're all happy to do, by the way.
Always.
I've had almost every area I think we do, which covers everything from the axilla, the under the chin, back fat, arms, abdomen,
stomach, thighs,
inner outer thighs.
Yes.
You can actually even do the little inner knee fat. So I mean, there's just such an enormous coverage of treatment areas for this. Show us what the actual treatment looks like. What do you do when someone comes in?
So normally when they come in, like Joyce said, I check their BMI and I kind of evaluate them. It has to be pinchable fat, so it has to be subcutaneous fat. The visceral fat, which is the fat kind of behind, we can't treat that only because I wouldn't be able to freeze behind something.
Behind the muscle.
Behind the muscle, right. So we evaluate you first, and then we will either schedule, or sometimes people choose to do it. If I have time, I'll do it that day. And the first thing I do is I do your weight, and then we do pictures. We kind of do pictures before and after.
Sarah, can you take a shot over there real quick of that? That's called a 360 evaluation on the floor there, that mat. You literally stand on that mat with your feet.
And you kind of turn around, yeah.
Which is to your benefit, because then once you've had your Coolsculpting and you know the weeks have passed by, Leslie can then show you this was before, and
we do
this
your
was
evaluation
after.
based on those pictures.
Yeah.
So it's really you know, a testament to what kind of progress you're making. Sometimes when you're looking at your body day in and day out, you don't notice those little changes. So we keep that picture documented of your progress. So you come back. How often do you come back for?
So normally I have you come back in 8 weeks, and like Drew said, the reason that happens is it's a slow burn. So sometimes people don't see it because they kind of get used to it as it goes. So sometimes they'll come in and go, I don't know if I see a lot. Then I'll show them the pictures, and it's for both of us really. It's for me to see how well I'm doing, for them to see how well they're doing, and then kind of evaluate and see if they need another treatment or how they feel about it. So that's kind of that part of it.
So let's say somebody comes in, and this is one of the treatment heads, although as you can see on the wall back here, there are several different treatment heads. Yeah.
Yeah.
And then when she assesses, I've pulled a couple props for you. There's different sizes based on the head. That particular one is the one we most commonly use, and that would look like this for your, those are the tools that she uses to mark, essentially. So for an abdomen, a lot of times for women, it's 4 of these, or sometimes the large one here. Which
I like to try to use the larger one. It's 2.5, but sometimes it's just not feasible to use it because if you're a smaller person, it kind of won't fit and it'll be too big. So I like to use that one. Yeah, I think it gives people a bigger effect because it's 2.5 times. But if not, I'll use this one. And we kind of feel. So I feel the I feel around and I kind of assess where the volume is, the highest piece of volume, because the middle of the applicator is the coldest, and I would put that on the volume area. So that's kind of how we do the assessment. And then I'll mark you with a Sharpie marker, which is kind of funny. And the reason I have to do that is after I mark you, I do some treatments here, and it has to be a Sharpie, otherwise those markings will come off, and I want to treat you exactly where I think that it's going to be the most effective. So. And
by the way, that's easily removable with alcohol when you're done with the treatment. So, and then after your markings, and again, these are critical to where you're going to apply the applicator.
Right.
But let's say it's this one, and that's the one that she has right there. She's done your marking, and then you have the patient lay down.
I have them lay down. I get them comfortable depending on where I'm going to treat them, and then I do a pre-treatment. So I'll do a pre-treatment wipe. It kind of gets the area ready for the treatment. They call it an antifreeze. I'm not sure exactly what's in it, but it kind of protects your skin from the cold. And then the next thing I do is put the gel pad on. It's really sticky. It's a really thin t-shirt material. It doesn't tear, but it protects from the cold, and it also helps the applicator stick. And then what I do is I turn the machine on, and then I place the applicator in the spot that I marked. I secure it I have a strap on here, and then I secure this. I put this around your back or front, depending on where I put it. And I secure it with Velcro.
And there is like a suction, it does kind of suck that area in, yeah.
And I make the patient comfortable, make sure they feel okay before I turn the cold on, because I want to make sure everything's good before I turn that on, because I don't want it to move or have to adjust it or anything.
A lot of people that come into for these treatments are amazed at it's such an easy procedure, not uncomfortable at all. And before we bought into the Coolsculpting equipment, we brought in several different devices to see how effective they were and how comfortable they were for the patient. This by far was, for the staff, hands down, no comparison. The heat-based procedures sometimes are super uncomfortable, and this one is, I mean, you kind of get numb quickly, and it's not unpleasant at all, really. People will say they feel like they're spending the day at a spa when they're getting treatment, and you can do multiple areas in a day. Each treatment, by the way, we have the newest technology in the device heads. So the old device heads, the old applicators, took much longer to do a treatment. So now, rather than being an hour for a treatment, this is only 35 minutes. So when you're applying it to different areas, if you're doing the abdomen and let's say you're doing 4, so you're not here an exorbitant amount of time. But we have patients that will literally spend the entire day with us getting multiple areas treated. So this is the device though, and as you can see, there are different applicator heads that we can add to this. But if you see inside of that device, can you see that really well, Sarah? So this is a cooling chamber in here. That's a gel trap down there that just contains that gel from that
This gel can't get
sheathing
into the machine, so they kind of protect it with that. And this is sensors on the outside.
But this is where the cold comes, and as you can see, that's very concave, draws the suction, draws that fat, that's loose. Another question that we get asked a lot is this going to hurt my internal organs? I feel like, you know, this could be damaging. No, it's not going to damage anything. It's pinchable fat that's on the outside of the muscle wall, so you're not hurting yourself at all with this treatment process. So rest assured, we can answer all those questions again if you come in for a consult. But that is the cooling panel. That gets cold within a few minutes. It's very numb, completely comfortable, comes off in 35 minutes, and then Leslie will do a massage. Tell them about the massage, Les.
So they, like Joyce was saying, it's very safe. They did a lot of research and a lot of studies, and they made sure it's not bad for liver, kidney, organs, things like that. Another thing they did research on is massaging. They noticed that when people massaged 2 minutes, or for 2 minutes after the treatment, they had a 68% better outcome than before. They actually did patients where they would massage one side and not the other, and the result is amazing.
So basically, weren't they I think the story is your fat cells are destroyed essentially by that cold over the period, but there are some that are lingering.
Right.
And so by doing that massage, you break down those few that are kind of on the precipice of being destroyed, and then you can expect an additional 68% of those.
And it kind of feels good too. A lot of people say it feels good because it's really frozen when I pull that off, and sometimes it looks like a block. And when you massage that, it kind of feels good. It gets circulation back and
warms it back up.
Yeah, so people feel better.
So when do you start seeing results?
You normally will see, it's hard to say, they say 8 weeks, but I've had people in 4 weeks. It's really dependent on the person, but I've had people come back in 4 weeks and I've definitely seen results. They've come back to get other treatments and they've seen results in the area that I treated. So, but normally 8 weeks is when you're going to start seeing results, like visible results. So 8, and then it goes to 16 weeks.
So I know for me, like we said, it's a gradual. It is a gradual, and so you're used to seeing yourself a certain way every morning when you wake up. And I think for me, when I treated my flanks, it was just one of these days. I just woke up one morning and I was like, wow, it worked.
And that's an awesome feeling.
It is.
Awesome feeling, And then to see it progressively get better over the course of 3 to, essentially I think full results are definitely by 4 months. But, you know, it's a fun procedure in that you are not doing anything invasive and in and out treatments.
Back to workouts, back to work, back to, you know, running the kids wherever. It's, in and out, no, zero downtime.
And for any men that are watching, huge response for men. This is one of those things.
In the last couple weeks, I've treated two husband and wife couples. Where they both came in for
couples come in, spend the day together. But what's kind of cool for men, and we hear the same thing for women, but women have stubborn fat areas, but men are notoriously that little muffin top, on the back for men, and lower abdomen is real common. Where women, we kind of have everything spread in, you know, multiple areas, but like I said, it's one of those procedures that you're totally comfortable through, gonna see the results, definitely gonna see a result, and the fact that it's safe for men and women, and you know, like I said, come in, free consultation with us, give us a call. We have a special this month, 20%. We also have an event coming up
September 13th.
Yes, September 13th.
So call and make an appointment for that, which will be an all-day Coolsculpting thing. But we do ask you to RSVP, because then you will be meeting with one of our Coolsculpting experts, and you'll have your own little mini appointment, and we'll have, you know, a little discount with that as well. But we also have something for you today too. So I know all of you avid Facebook fans of ours. We really appreciate, again, the feedback from all of you. So like and share our video. Always, we appreciate that. But you have until midnight this Sunday the 29th to leave us a comment down below, and then you will be entered into a drawing for one of our amazing hydrofacials once again. So like, share, and remember to comment to be entered into the drawing.
And check us out on Instagram. We just got a
yes. So we also launched on Instagram. Thank you so much for that. Yeah, so check us out. We're having lots of fun with it. It's a good time. So.
Oh, and we have one more thing. So Brilliant Distinctions, Coolsculpting was bought by Allergan. So now Brilliant Distinctions is offering until I think September $200 coupon if you do 6 areas. So
in addition to our discount that we're offering, right? And for the event that we're having, so we have 20% off for the month of this month, and then we have the 25% off for September 13th.
Yes, the event on the 13th.
And you get to watch Netflix.
Yes. We've got a lot of goodies for you.
So come chill with us. We'd be happy to have you come in and visit us.
Yep.
Thank you.
We'll see you guys next month.